Nebivolol. Nebivolol is a beta blocker used to treat high blood pressure and heart failure. As with other B blockers, it is generally a less preferred treatment for high blood pressure. It may be used by itself or with other blood pressure medication. It is taken by mouth. Common side effects include dizziness, feeling tired, nausea, and headaches. Serious side effects may include heart failure and bronchospasm. Its use in pregnancy and breastfeeding is not recommended. It works by blocking bone adrenergic receptors in the heart and dilating blood vessels. Nebivolol was patented in 1983 and came into medical use in 1997. It is available as a generic medication in the United Kingdom. In 2019, it was the 191st most commonly prescribed medication in the United States, with more than 3 million prescriptions. Medical uses. It is used to treat high blood pressure and heart failure. Nebivolol is used in the treatment of angina to decrease the heart rate and contractile force. This is relevant in patients who need to decrease the oxygen demand of the heart so that the blood supplied from stenosed or constricted arteries be adequate. AC inhibitors, angiotensin Roman II receptor antagonists, calcium channel blockers, and thiazide diuretics are generally preferred over beta blockers for the treatment of primary hypertension in the absence of comorbidities. Contraindications: severe bradycardia, heart block greater than first degree, patients with cardiogenic shock, decompensated cardiac failure, sick sinus syndrome unless a permanent pacemaker is in place, patients with severe hepatic impairment child pug class B, patients who are hypersensitive to any component of this product. Adverse reactions: headache, paresthesia, dizziness, slow heart rate. Pharmacology and biochemistry. Bone selectivity, vasodilator action. Nebivolol is unique as a beta blocker. Unlike carvedilol, it has a nitric oxide no-potentiating, vasodilatory effect via stimulation of B3 receptors. Along with labetalol, celiprolol, and carvedilol, it is one of 4 beta blockers to cause dilation of blood vessels, in addition to effects on the heart. Antihypertensive effect. Nebivolol lowers blood pressure (BP) by reducing peripheral vascular resistance and significantly increases stroke volume with preservation of cardiac output. The net hemodynamic effect of nebivolol is the result of a balance between the depressant effects of beta blockade and an action that maintains cardiac output. Antihypertensive responses were significantly higher with nebivolol than with placebo in trials enrolling patient groups considered representative of the U.S. hypertensive population, in Black people, and in those receiving concurrent treatment with other antihypertensive drugs. Pharmacology of side effects. Several studies have suggested that nebivolol has reduced typical beta blocker-related side effects, such as fatigue, clinical depression, bradycardia, or impotence. However, according to the FDA, bistolic is associated with a number of serious risks. Bistolic is contraindicated in patients with severe bradycardia, heart block greater than first degree, cardiogenic shock, decompensated cardiac failure, sick sinus syndrome unless a permanent pacemaker is in place, severe hepatic impairment child pug B, and in patients who are hypersensitive to any component of the product. Bistolic therapy is also associated with warnings regarding abrupt cessation of therapy, cardiac failure, angina, and acute myocardial infarction, bronchospastic diseases, anesthesia and major surgery, diabetes and hypoglycemia, thyrotoxicosis, peripheral vascular disease, non-dihydropyridine calcium channel. Finally, bistolic is associated with other risks as described in the adverse reactions section of its PI. For example, a number of treatment-emergent adverse events with an incidence greater than or equal to 1% in bistolic-treated patients and at a higher frequency than placebo-treated patients were identified in clinical studies, including headache, fatigue, and dizziness. FDA warning letter about advertising claims. In late August 2008, the FDA issued a warning letter to Forest Laboratories citing exaggerated and misleading claims in their launch journal and, in particular, over claims of superiority and novelty of action. History. Mylan Laboratories licensed the U.S. and Canadian rights to Nebivolol from Janssen Pharmaceutica NV in 2001. Nebivolol is already registered and successfully marketed in more than 50 countries, including the United States, where it is marketed under the brand name Bystolic from Mylan Laboratories and Forest Laboratories. Nebivolol is manufactured by Forest Laboratories. In India, Nebivolol is available as Nebulizidus Healthcare Limited, Nebizoc Ares Life Sciences, Nebisip Cipla Limited, Nebulong Micro Labs, Nebistar Lupin Limited, Nebocard Torrent, Nubeta Abbott Healthcare PVT Limited India, and Nadon Cadila Pharmaceuticals. In Greece and Italy, Nebivolol is marketed by Menarini as Lobovit. In the Middle East, Russia, and in Australia, it is marketed under the name Nebulit, and in Pakistan, it is marketed by the Cyril Company Limited as Byscard.